Welcome back to Health in Today's Woman. Tonight we've been having a discussion about back to school, and I've been joined by Dr. Brent Rosser, pediatrician at the Murfreesboro Medical Clinic. In our first two segments we talked about both kindergarten as well as middle school. In this one we're going to take on the issues that face kids as they return to high school. Now Brent, I want to kind of start off with just what we've done in each segment, which is talking about the medical requirements to get into high school. What are the medical requirements to get into high school?
Well, again, they're going to look at their immunizations again. It comes up all the time. And the big grade, besides 7th grade, when children reach 11, they require a tetanus shot and a meningitis shot. So that's really in that middle school age.
Okay.
But we get quite a few high schoolers that have come in that haven't had those immunizations.
Right.
That need caught up with that, or maybe even some other shots that they missed. And then again, we talk about the HPV shot again. Now,
one of the things we mentioned in our last segment, but I want to bring it again in high school, is the whole idea of sports physicals.
Mm-hmm.
And especially in the high school age, this is a big deal. And we were talking about this at the break, that this isn't something that you just need somebody checking off the little boxes. This has really gotten to be a serious thing because we've seen too many injuries is why it's gotten to be so serious. I want you to address that a little bit because I think it is a very important topic that parents need to understand.
Well, things get ratcheted up a little bit in high school. It's more competitive. The athletes are bigger and stronger and faster, and TSSAA has different forms that we have to fill out for them to play these sports. And so it's important to talk about their history of injuries and talk about things like we mentioned before, family history. And it's also a great time to get, when they're in the office, talk about social things and some of the things that, you know, I think high school athletes nowadays, there are more temptations to take supplements and creatinine and protein shakes and things like that. And it's a great time to sit down and just talk about the risks of those things with those athletes.
That's where I want to move to next, because this is a change. When I was in high school, kids were playing high school sports because it was fun. And I think they're still doing that, but there's a lot more pressure to, this may be my ticket. I mean, if I'm good enough and I can play, I might be able to play at the college level. So there's a lot more pressure on kids that we were seeing in high school, or excuse me, in college when I was growing up. It's now moved into the high school years. How can parents kind of be aware of this and make sure their kids aren't using these supplements or aren't using anything that's unhealthy? How do you discuss that with parents about what to watch for?
Well, it's really difficult, and like you said, there's lots of pressure on these athletes. Even if it doesn't look like they have much of a chance to play college, all athletes think that they do. And it's easier to get these things, like I mentioned, protein shakes, creatinine, things like that. You can walk into any health food store and get those things. And so we try to talk about the health risks of those, but also you'd get into some of the illegal things like steroids and taking things like stimulants and those type of things. Typically, they're going to see some physical changes we talk about with the steroids, but also lots of emotional and social changes. A lot of these kids, their grades will start slipping, or they have some emotional and anger problems or things like that. And if a parent mentions those things, that they think that their child has changed in those ways, then that pops into my head that maybe we need to look into that.
Now, you bring up an interesting point. You bring up grades. It's not just athletes that are feeling pressure in high schools now. A lot of kids are feeling pressure of, I want to go to such and such a school, so the only way I'm going to make it to this school is with an academic scholarship. So there's a lot of pressure on kids, not only athletes, but just kids in general. You know, how do you address that with them? And also, they're oftentimes using supplements or using things to keep themselves awake because the school has gotten so much harder. How do you address those issues?
Well, again, these are medications that you have to have prescriptions for, and so luckily I haven't had a lot of problems with parents or students asking me for those things in high school. But if they're getting them without a prescription, it's illegal, and so I stress that. And also the parents need to look for, it can be subtle, to look for changes in their emotional stability, or their moodiness or things like that. And also just stress to the kids that colleges don't look just for grades. They look for a well-rounded person. They need to have other things going on, whether it be extracurricular activities or church activities and those type of things. That's what colleges look for nowadays. They look at grades, but they want someone who also is involved in other things.
And there are so many things out there, just like you're mentioning, that they get the health food store, they can get like no-dos or whatever you want to mention. There's all kinds of things that are out there. I'm not saying they're not safe, but they just got to be careful. We all remember the patient or the student in college that got pulled out of the dorm during finals because they were, overdosed on whatever it might have been, some kind of caffeine kind of thing. Do you see that in high school kids, or is that more of a college level thing?
Well, I think it's more common in college, but I think it's creeping into the high school ranks. But that can be difficult to, especially if they just go get a Red Bull and drink that. Like you said, it's not illegal. One every once in a while probably isn't going to hurt them, but if you overdo it, you may have some physical problems from that. So I stress that.
The other issue that we get involved in with this group, and I don't want to always just take the bad things, is drugs and alcohol. I want to kind of really briefly put two things together here. One is partying, and not every kid that's going to parties is drinking, but we got to make sure they're safe. But also paying attention when, okay, they are partying and they're getting out of control. How do you deal with those two issues?
Well, again,
kind of separate?
Again, I try to talk to the patient one-on-one lots of times, because lots of times they're not going to tell me things in front of the parent.
Right.
And I stress to them that what we talk about can be confidential. Now, if they're doing something I think is they're harming themselves or illegal, then I'm obligated to tell the parent.
Right. That's
but
important.
I stress to them that, first of all, what they're doing would be illegal. They could be arrested for this, and if that goes on their record, that could affect college or sports. They may get kicked off their team or not even get that scholarship that they're looking for. And also the physical problems with that if they get involved in alcohol, that may lead to different drugs, harder type of things that may affect them down the road. Interestingly
enough, when I was in Texas applying for my license, you have to put anything. I think you may even have to put, if you're arrested as a minor for any kind of drinking issues. Kids don't think about this kind of stuff. The FAA requires it. I've had this discussion before with one of the professors at MTSU. So this is not something it's a big deal, and it can really affect your career in ways that you never thought about, can it?
Absolutely. It can follow you for the rest of your life if you make that one mistake. And you may have problems finding jobs or getting into the school you want to just because of that one thing that you did. So
we'll be right back after these messages to wrap up the show. Back to Health in Today's Woman. Tonight we have taken on the topic of back to school. I have been joined by Dr. Brent Rosser, pediatrician at the Murfreesboro Medical Clinic, to discuss the issues that have been facing students all the way from kindergarten through high school. We have talked about sports physicals, we have talked about issues facing high schoolers, including academics, as well as social issues facing both kindergartners through 6th grade, as well as going into the middle school years. I want to provide you with the information for the Murfreesboro Medical Clinic's Pediatrics Department and Dr. Brent Rosser, so that if you do need a history and physical exam for sports, you can provide that at our clinic. Thank you and good night.